So we're going to take a brief break. Eric Hargan is the Deputy Secretary of the Department of Health and Human Services, and he's stopped by and he's going to add something to our conversation briefly, and then we're going to continue from there. Would you like to come up here, or? Thank you for joining us and giving us your time here. I apologize for getting started here, but we're glad you came by.
Yeah. For something brief from a lawyer and a government official. Good luck to you. But anyway, thank you for that introduction. Thank you all for having me here today. It's great to be with you all here at CPAC and have a chance to talk about such an important topic. I'm really going to talk about it from the point of view of the administration. I'm the Deputy Secretary of Health and Human Services in the administration, and this is my second time around at HHS. I spent 4 years there under President Bush. And HHS is one of the sort of central departments, and have a lot of the agencies that really deal with the issues of family from a governmental point of view. So I'm going to run through some of the things that have been happening inside the Trump administration that I think have helped move along the role of the family and have helped remove some of the barriers. We know that stability from a strong family that it can create for children is vital. It serves as a springboard to success later in life, and social science backs this up. It's largely uncontested that kids who grow up in stable families have better health and education outcomes and are more likely to avoid poverty. Children that grow up in two-parent households are significantly more likely to graduate from high school and more than twice as likely to graduate from college. Kids who grow up with committed fathers are 75% less likely to have a teen birth and 80% less likely to spend time in jail. These are all significant numbers, and these obvious benefits bring up a question: what role does the federal government have in strengthening families? Now, in my day job, I am more generally up to date on the Federal Register than First Things, but I'm told that it's a current debate taking place in conservative circles, and I'm sure it's going to continue taking place after I leave. But what I want to lay out for you today is how committed the Trump administration is to strengthening the family, in large part through the inevitable ways that any government will affect family formation and family stability. Government policy will always affect families, and we want it to be a boon, not a barrier, to strengthening them. That's just one example. We are completely devoted to protecting religious liberty here at home, which helps families flourish, and to protecting life from conception to natural death. A respect for life that undergirds our view of the family. These are fundamental commitments of our government, and the Trump administration takes them extremely seriously. As many of you know, the Trump administration proudly stood beside the Little Sisters of the Poor and so many other groups and individuals and fought to provide them with the regulatory exemptions they deserve under Obamacare's contraceptive mandate, and we're continuing to fight for those exemptions at the Supreme Court. We also issued a rule that to enforce approximately 25 statutes that protect health professionals' right not to provide procedures that violate their consciences. And we created a division within our Office for Civil Rights at HHS that is specifically dedicated to conscience and religious freedom protections. The first time an office like this has been set up within HHS, and to enforce 25 statutes that were already on the books and have remained essentially dead letters for sometimes decades that were supposed to protect conscience, particularly of medical providers, but which had not ever been enforced. Now, in our ongoing efforts to protect life, we recently had some good news come out the Ninth Circuit Court of Appeals out in California. That's not a phrase you often get to hear from a Republican administration official, but it was good news. By way of background, last year, HHS began implementing a rule that enforced existing statutory requirements under the Title X law. We no longer permit family planning services funded with taxpayer dollars from occurring at the same location where abortions are provided. And this week, the Ninth Circuit reaffirmed its decision to allow our regulation to proceed. This is going to ensure the integrity of the Title X program, so more women and men are provided services that help them consider and achieve family planning needs, but protecting taxpayer funds from being used for abortion. Now, we've been busy on these issues and we're not taking our foot off the gas pedal, but sometimes people say, well, you're dedicating to protecting life in the womb, but do you really care for people afterwards? I'm sure you've heard that before. The answer from this administration is a resounding yes, with a special emphasis on the family. So I'm going to mention briefly 3 areas that we work to ensure that government supports families rather than undermines them. Foster care and adoption, national sovereignty, here that was a question mark, I'm sure, for some people, and mental health. First, let's talk about the vital importance of adoption, which gives children not just stability and love in the short term, but a safe platform for kids to grow into stable, responsible, self-sufficient adults. The number of adoptions with U.S. child welfare agencies increased over 63,000 in 2018, the largest number of adoptions reported since data on adoptions began to be collected by the government in 1995. We put a significant new focus on promoting this, and Vice President Pence actually came to HHS to celebrate our adoptive families. And we've set a goal of finding homes for 125,000 children in the system today. And we have a bipartisan group of state governors that are working with us on this. Now that's a very lofty goal, even if that churches and religious and faith-based institutions have a huge role in making progress with us on this issue. Now, increasing adoptions is especially important when approximately 20,000 youth age out of foster care each year. And the outcomes for these kids are incredibly discouraging. Only 58% of children in this system graduate from high school, and only half of them will have found employment by age 24. More than a quarter of them will experience homelessness. These kids aren't able to achieve the independence they need, but finding a loving family can change all that. Now, thankfully, the latest data show the number of children in foster care decreased at the end of 2018 for the first time in years, while the number of children entering care also dropped. And we're working hard on providing the support families need to keep kids from entering foster care in the first place. Part of that is we're working to place fewer burdens on faith-based adoption and foster care services so that providers can do what they do best, including we issued a waiver that allowed a religious foster care provider who was being shut out of our programs to continue to participate. And faith-based organizations have a long history of helping in this mission, and our administration is dedicated to protecting religious liberty so they can continue to do that good and needed work. For many faith-based providers, that work is a calling, and we're not going to stand in the way of that. Now, turning to the international level for a moment, which I think is often a place where people don't expect to see family issues arise, this administration has worked to protect the idea of national sovereignty on matters that affect the family. Far too often, wealthy nations try to use international bodies like the United Nations to impose a certain social agenda on their fellow member countries without respect to what the citizens of those countries desire. And attacking protections for unborn life and family is one of the most common examples. We saw leadership in action on this front from a president 35 years ago when President Reagan implemented the Mexico City policy. That prevented taxpayer money from being used to promote abortion abroad. President Trump re-implemented and expanded that policy, and he's had leaders like our HHS Secretary, Secretary Azar, Secretary Pompeo stand up for life abroad. And this past fall, the U.S. joined with countries to make a historic joint statement at the Nairobi Summit, which was held to commemorate the 25th anniversary of the International Convention on Population. Now, inevitably, and unfortunately, the focus of some in Nairobi drifted towards trying to promote abortion as a human right, and we responded with what I call the Nairobi Declaration. It was partnership among a broad group of countries from the United States to Hungary, Uganda, Brazil, and others, which made the case for a nation's right to defend the family, to generate a positive agenda on women's health, and to reiterate there is no international right to abortion. And over the past year, we proudly joined with a large number of other allied nations, representing more than 1 billion people, on similar statements at the UN General Assembly and the World Health Assembly. And I believe the Nairobi Declaration will come to be remembered as a major turning point in the battle to preserve national sovereignty on deeply important sensitive issues like safeguarding the family and human life. And the final point I want to make is that strengthening the family means tackling the challenges that are at work to tear it apart, like mental illness, substance abuse, and listening to families and to communities of faith in that work. Families are often, even usually, the first-line responders, the first-line caregivers for people with substance abuse or mental health challenges, just as they are for other health challenges. We've worked to make sure families are supported in that work through expanding the use of community and home-based services in Medicaid, and that we're never standing in the way of family members helping out through reforms that we proposed and our substance abuse privacy protections that allow families to be able to get information about family members that are undergoing substance use disorder. Unfortunately, we find that sometimes health professionals don't appreciate or understand the role that faith plays in an individual's road to recovery, and so we're sponsoring a lot of sessions between mental health professionals and religious and faith leaders so they can learn from each other about how to address these issues in the context of family and faith communities. And I think everyone benefits when people work together on this issue. And the work to strengthen families goes on outside of HHS too, of course. Thanks to the President's leadership, the recent defense bill now provides 12 weeks of paid parental leave for the federal civilian workforce. And the President's tax cut legislation in 2017 created the first tax credit for paid parental leave, which targets those Americans least likely to have access to such a benefit today. So as you can see, we think the family is central to the strength of our country, and we remain vigilant in protecting Americans' liberties and working with families and communities to strengthen and revitalize the role of families, which of course helps us at HHS enable our mission of promoting and protecting the health and well-being of all Americans. So very glad you all are here today to talk through these important issues at a much more philosophical level than we do within the administration, where we're really focused on the laws and the regulations and the policies that are taking place here. But thank you for the opportunity to present what we're trying to do in the Trump administration to strengthen families. Thank you.
Thank you.